Thank you, Larissa. Our next speaker is from Dallas Health Department, Jen Edwards, and she'll be telling us about their experience with CHA and CHIP.
Hi everyone, how are you doing? Good? Okay. So what I'm going to talk to you all about today are really the methods for getting this community health assessment done and in a format that is usable and that won't sit on a shelf. And hopefully you'll find it to be a fun process, you know, something that you like doing and that you like engaging people with. Overall, my objectives are kind of the same as everyone else's that have been up here today. I think what you'll see is that we have the same themes, but we've all slightly adopted them a little differently. But the end result, you know, still turns out to be the same. So here's the community health assessment, or the community health needs assessment. Here's one definition of what it is, and it's from an international organization, and it just shows that we're not the only people thinking about the population, about the community, and about public health. And when we were doing our health assessment, this was true to the values that we wanted to embody, and we particularly wanted to make sure that we focused on our diverse populations and really focused on how can we address inequalities that might exist in our county. And just as a side note, we're Dallas County Health and Human Services. There actually is a smaller city health department, but they don't really handle too many responsibilities. It's primarily us with the county. And here's the IRS definition of a health assessment. In true IRS form, they said a health assessment is an assessment of health. You know, perfect, right? And you all have heard about the requirements for some hospitals to have to do these health assessments. So we wanted to be mindful of this definition as well. And what we're going to move forward with is using this health assessment for our improvement plan, and then using it for our strategic plan. And then we want to also just see, are there new objectives that we need to be looking at to meet health issues? And our hospitals are kind of taking the assessment in a different direction and just making sure they're meeting their IRS requirements and possibly realigning their services if they need to. So it really is a document that's supposed to be usable by everyone. And I actually sat down and looked at the Schedule H, which is actually not that scary. It's a long document, but the portion that relates specifically to the health assessment, particularly if you're partnering with a hospital, I would recommend that you look at it. But it's pretty user-friendly and straightforward. I won't stay on this segment too long because we've gone over the requirements for the CHA, but my recommendation as you think about how do I want to put this assessment together is that you really use the requirements as a roadmap. They're there to help, and they talk about partnership, they talk about how often you should meet with your partners, and really what sections should even be included in the health assessment. So even if you just start there and say, well, what does FAB want from us? And then move forward. And it even specifically addresses the kind of data that should be included. And it even talks about, you know, having community input, and you want to talk about assets and resources, which is kind of a paradigm shift. A lot of times we've been focused on just community needs, but we also want to talk about assets too. We don't want to come up with this great report based on data and say, hey everybody, so we've got a problem, and then keep moving. We want to say, here are the issues we've identified, and here's what we have currently existing that can address them, and here are some things we might want to also think about. So I'm going to talk about the steps that at Dallas County Health and Human Services that we went through to accomplish the health assessment. It took us about, not including the bureaucracy of getting a contract secured, it took us about 6 months. And I just really want everyone to feel like it's a manageable process, a feasible process, and to partner until you're blue in the face. You know, it's not something that you have to lock yourself in your office and do. So, first, before we even started with the assessment, we had to say, what do we want our assessment to look like? We happen to be, a city, primarily urban kind of area, but your health assessment is going to look different and have different considerations if you're rural or even if you're suburban. So first, just start thinking about that. And then we said we wanted it to be comprehensive. So our partnership, bless you, our partnership was really good at not only thinking about these are disease issues, but we also thought of it as a bigger picture. Like, here are social constructs we should look at. Here are relationships across healthcare sectors we want to look at. So we really tried to take it outside of the box as well. We're a diverse area, so we obviously wanted to have culturally competent considerations, and we wanted it to be practical. At the end of the day, this is a report that's going to be read by more than people in public health or with strong public health backgrounds. So we want everyone to be able to understand it. And then once you kind of have that background, you kind of move into, okay, what do we want to look at? Particularly relating to FAB, it seems like they really focus on healthcare access, I would say. So we chose a human rights and social justice paradigm. You don't really write that anywhere, but that's just something that you want to keep in mind as you're recording your data, as you're looking at trends, saying, so who's missing out here, who's not missing out here, and document both. Sometimes we get in the habit of documenting who's doing the worst, and we don't make note in the other direction. So we just have to make sure that we're mindful of all populations. And then to move forward in our process, we worked with our public health improvement work group. So I encourage you to really sit back and think about who are people that would have a good background in this, who can provide meaningful input here. Who are the people that may not provide meaningful input, but they've been in the community for 30 plus years? If they're not on this task force, it could be a problem. I mean, really make practical considerations and put together a work group that can get things done. We had about 25 invitations sent out. I think more than that is a bit extensive and you might have a problem getting work done. And we were sure to represent different sectors in the community. So we involved hospitals, we involved our school districts, we involved universities, our nonprofits. We tried to have a good cross-section. If we had one organization that was for STDs and HIV, we probably wouldn't have others. If we had one organization that was for chronic disease, we wanted it to be representative. We weren't trying to get everyone, and we made that clear up front. So partnerships. Our core partnership was with our local nonprofit hospital, and then we worked with New Solutions, which is a consulting company. And really between the three of us, we had a good mix there of capabilities and of skill set. My strength tended to be on the methodology, the design of it, putting together the health assessment so that it really is a story that can, be taken to the next level to be acted upon. And then also really reading it and making sure the language is consistent. Because when you have a hospital coming together with a health department, sometimes your language isn't quite the same. So, I was navigating all of those dynamics and doing the editing and the writing. And New Solutions was really helpful with reporting and secondary data collection and getting the report together in a good format. And having a hospital partner, I would hope that each of us at least could think of one hospital partner. They had a wealth of data. Obviously, because it's a hospital, it's outcomes data, and sometimes representing to them what it meant to prevent something got to be a little difficult, but the health assessment really does a good job of balancing both perspectives. So that's how we did it. And then we defined our service areas, and this is how our whole report talks about health. We talk about, here's what's going on in North Dallas, here's what's going on in South Dallas, here's what's going on in Wilmer-Hutchins. We really narrowed it down to the communities and the neighborhoods that we're familiar with. And that helps with data manageability so that you're not just talking all over the place. So you'll see, and this even demonstrates some of our mapping. We show where different sorts of facilities are. And just as background, primarily our southern sector of Dallas is really lacking in pretty much all resources that you can think of. And like I said, we think a little bit outside of outside of the box, and we even included maps of our public transportation system and showed that transportation isn't even very great down there. So think about things like that. And then, as I've already said, just make sure that, at the end of the day, everyone is there because they want to improve community health. I think that's what everyone can unify and rally around. And just some strategies for engagement, which I'm still growing in this particular area, and I've appreciated everybody's presentations and resources so far. Make sure your work group is representative. Make sure you have buy-in early. If you see someone that seems to be a little hesitant, a strategy that I learned is that that's the person that you go to and say, so we want you to take the lead on this, and talk to them, and then they're absolutely engaged in the process. And then we also, engage the work group as far as the timing of our methods. Even though we had our methods defined, we went to them and said, so when's a good time to do this? And who do we want to pull for our interviews? Who do we want to pull for our focus groups? So at the end of the day, we have a report that is based on feedback from our work group, but then also people that they found valuable to provide feedback. So pretty much if everyone is bought into the report, at the end of it, everyone's pretty happy, and you've been getting feedback all along. And so that just helps with the process of our internal approval. And then, of course, I would always share things with our hospital partner first, and then with our work group. And right now, the health assessment is posted on our website, hopefully under About Us. I was trying to get it done before the conference, so we actually posted it on Friday. And then we're going to collect, public comments because FAB says we should, and that's just good practice anyway to make sure that we've covered all bases. And then in the last few minutes of our discussion, I'll just talk about how we attempted to organize our data. We started with our work group and said, hey, work group, what are our problems here in Dallas County that we need to address? And this is the list that we came up with. And it's a good starting point because, as you heard yesterday, you don't just want to start clicking around with a ton of indicators and you don't really know where you're going, or make a data request that says, give me what you got. That's not too helpful. So we started with our work group and narrowed down our list. And then we, talked about, okay, so where do we get this information? And we had great resources from our hospital, and then we also have the Dallas-Fort Worth Hospital Council. So I recommend that you, take a look at your nonprofits and see what resources they have to offer. And then, of course, I would have to say, I was telling somebody yesterday, my favorite link was the link that says email the Center for Health Statistics at the State Health Department. So we used quite a bit of DSHS data as well. And then we also used the county health rankings, and then United Way also has a report that has a health component in Dallas. And overall, at a high level, this is the methodology that we used. We started off with a community focus group, and then we did our secondary data collection, and then we had opinion leader interviews. And then we finalized the list, and that's where the report kind of wrapped up. So we started with us, we cast a wide net, then we brought it back in pretty much. That's how we got the health assessment done. And these were the tools that we used along the way. You have to write everything out. If you're interviewing somebody, you want to know what you're asking, so you have an interview guide. Or if you're conducting a focus group, which is what New Solutions helped us with also, we had an interview focus group guide. So just make sure that you're documenting what you've done, and also because next time around it'll be that much easier, and if someone else is helping you with it or is in your place, you kind of give them a good place to start. And then we have our outline that we found, which we used this from the beginning, and we really based it on the FAB requirements. And I'm kind of clicking through these slides in the interest of time, but also because I'm just kind of hoping you get the concept at the base of it. So we were looking at the FAB requirements for this. And we managed all of our data using this kind of a format. So when it's time to really find out what your trends are, you have to know, what it is you're looking at. What level do you have the information at? If you only have data for a certain topic at the state level, that might not be something that great to focus on your community health needs assessment, unfortunately, but you have to know that. So this is kind of how we organized all of our data. And on your flash drive, you'll see that I gave you guys it's a traffic light data summary. And you'll see pretty much the red lights. If there's a lot of red lights, that's where we focused our attention, like, oh, there's a need here. What trend might we be seeing? And that was really based on our chart that we have that had all the data in it. So yes, the narrative is great for the health assessment, but you really have to start with the charts first and then kind of build your way up. And then we identified our top issues and narrowed down the list. And just as an FYI, this is what we came up with in Dallas County, which will probably be different for your county. We found that we were very strong with a lot of good local resources, but our resources didn't all necessarily know what each other were doing. And then we also, not chronic disease in itself, as I mentioned, we kind of tried to step outside of the box. So diagnoses of multiple chronic diseases in the same person is what we came up with. So how can we focus on risk factors for diabetes, cancer, all these diseases that we're finding put together? And then health disparities is something we had to be very careful, but it is a real issue to address. Changing health insurance coverage. How can we make sure that individuals who might not be able to access health insurance, who now are able to access insurance, how can we make sure that they're able to get services? Because we also know that providers may or may not accept it. So we have to be careful about the wording, but that was something that we wanted to capture. So I'm kind of running out of time, but those were the top 5 issues. And then this kind of goes into the CHIP, which we haven't done as much, but these are the things we're going to consider for the CHIP itself. How can we target risks? And we want to take a community organizing paradigm. And then we'll use the interview and focus group findings there as well. And then these are the key lessons that we got. Leverage your resources, get buy-in early, partner with a local hospital. I can't stress that enough. Community benefit office, population health office, something like that. And then just make sure that this is a helpful tool for everyone and that it's not your health assessment. So any problem you identify, you're not saying that you're going to fix it. It's a collective issue and there's collective responsibility. So just make sure that everyone's aware of that, and it makes it a lot more of a fun, engaging process. And then overall, I would say really start with what you know you have. You don't want to go down a path and then realize you don't have the information. And that sums it up. Just in general, if you have questions, you can always call or email. Our website is up there under About Us. Hopefully our health assessment is posted now. But if not, contact me and I can give you any of the tools that you've seen that I mentioned today. So that's it. Thank you.